Okay, so hi everyone. For our team, we also had the opportunity to be summer interns for MCNHR, and we call ourselves the Three Musketeers. We are not so short, we are not so tall. Yeah, so Naomi, she's Kira, and this is Ashley. So a little bit about who we are and what we did this summer. So I'm a fourth year Master of Nursing student, and that's my third year being an intern at MCNHR. I had the opportunity to work with Dr. Benita Cohen and Diane I worked on 2 projects and had other service requests that I did, and I also attended 4 workshops. So for my first project, it was a summer research internship evaluation. We've worked on this over a year. But this time around, I was doing data collection, data analysis, and reporting. And we also have a manuscript for publication. We developed some posters. We'll be having a conference in October, so we had to work around it. And also had opportunity to attend research meetings. And my second project was with Dr. Benita Cohen. I attended research meetings with her at Ready Faculty of Health Sciences at Bannatyne, and it was basically looking at social justice and health professional pre-licensure education for the faculty. And we also conducted lit reviews, and finally we've written a background for a grant application. And then I also had the opportunity to work on the College of Nursing faculty survey and other lit searches.
Great. And I'm Ashley. I'm a 4th year student. This was my second summer as an intern, and I got to work on a few different projects. The first project I got to work on was my team empathy project with Dr. Michelle Lobchak. So I worked on this project last summer, so it was a continuation. I updated a literature search on interprofessional team empathy or communication during discharge rounds, and I got to start preparing a manuscript. This let me learn a lot about refining lit search techniques, data extraction, and academic writing. The second project I worked on was the new grad employment preferences with Diane Sapanik. It was based on the provincial new grad nursing grad survey, and we looked at the preferences for full-time or part-time employment and the rationales why. And this was the first time I got to do some qualitative analysis and look at themes, and I also got a chance to do more academic writing. I've also been able to do various service requests, such as an analysis and lit search on nursing honors programs, and editing and formatting many different manuscripts.
And I'm Kira. I'm a 4th year student as well. This is my first year working at the MCNHR in any sort of research field or experience at all, so it's really interesting. And my main mentor was Dr. Wanda Snow. She was always there when I had a question, and I had a lot of questions. She was very patient with me. And also Diane was very helpful as well. So the 2 main projects I worked on were enhancing research capacity in nursing. I'm sure you guys have gotten some emails from me. So that one sort of, I learned a lot about the ethical approval process and everything that went into that, and also a little bit about qualitative interviewing. And then also for the next project, Anxiety in the Nurses, I learned about literature searching, data summary extraction, and sort of about forming hypotheses, trying to make connections, and looking to the literature for that. And then I got to work on other really cool service tests, stuff I hadn't really done before, like making graphics, paper editing, literature searches. And through this I got to work closely and correspond with a lot of faculty, such as Dr. Woodgate, Dr. Reiger, and Dr. Cohen. So thank you for trusting me with those service tasks. And then we also got to do lots of activities, which people have mentioned. So Naomi actually served as a panel member on a Summer Research Training Institute workshop for new research assistants, which we all attended, and she did a great job. And then Ashley got to visit Dr. Lobchuk's care lab at the Grace Hospital related to her project. And then one of my favorite things was the Biomedical Youth Day Camp, which people have talked about, just getting to sort of see the next generation as well.
So we will say that the summer internship had tremendous impact on our academic, our scholarship, and other extracurricular activities. So for academics, we've gained valuable skills that we can implement in our clinical and even in our academics. And we've learned how to we've learned the tips for grad school, and I know a lot of them are willing to do their masters and PhDs and stuff. Thanks to Donna for the insight. And then we have scholarship. Some of us are on publications and other things, and also some had the opportunity to present at conferences and stuff. Then for the extracurricular, we're able to give back to community, helping with building for humanity, and then with this gardening and all kinds of stuff. So that really helped us. We built soft skills. Now we know what teamwork is all about, how to communicate with people from different backgrounds and stuff. So that is a plus for this internship. We've learned a lot, and we are so grateful to FCNHR for this opportunity.
And with that, we want to thank you. Thank you to the MCNHR, to Dan, James, Wanda, Susan. Thank you so much for everything you've done this summer. To our mentors specifically, thank you for providing us guidance and instructions on our project, and to the whole College of Nursing for welcoming us this summer.